patient. So in polyclinics, is it the nurses only who see them or the doctors there as well? Do you know?
Yeah. So initially, when they first go, the first 2 to 3 weeks, almost all babies have jaundice, it's physiological jaundice. So I think that will be the first time they go to the poly. Usually it's just the nurses. They do the jaundice check and go back.
Okay.
They don't really need to see the doctor. Unless the jaundice level is high, then they will be directed to see a doctor to see what else needs to be done. Do they need to be referred back for phototherapy, the blue light therapy? Then subsequently, I think for the vaccine checks, usually they do some of the visits is just jab and go, and some of the visits after the jabs they have to wait for the doctor consult.
Okay, understand. Also, doctor consult is only when necessary.
Yeah, at certain time points
and certain time
along the way. Yes, correct.
Okay. Do you know, like, have you had kind of practice in the polyclinic before as well? Because this is something I'm curious about from after hearing from the moms that we interviewed, right? Like, how much on breastfeeding is actually addressed, during their visits to the polyclinic?
In my own experience, I think I've also tried out being there as a parent myself.
Okay.
And actually, unless you ask for it, I think they won't necessarily address about breastfeeding. I think in general they'll just ask how's the baby being fed, and the baby is thriving well. Usually, I think people don't waste time and dwell into the details because the baby is growing well, gaining weight well. So I don't think there's really a need to because the baby has been probably been fed the same way for a few months already. Yeah.
Okay, so the priority is to just check the vital kind of different things, right? Parameters to make sure.
Growth and the development. Yeah, the priority at the poly is the growth and the development.
Okay.
Because they need to fill up the health booklet. If you open the health booklet, then there are those growth parameters and also the development milestones and also the growth chart at the back. So those will be already quite a lot of things to fill up.
I see. Understand. So, what is your view on breastfeeding?
I think it is definitely the way to go because evidence has shown that there are a lot of benefits, not just the emotional bonding, but also in terms of health measures that long-term benefit in terms of reducing allergies, and also some emerging evidence that the children could be brighter. So a lot of benefits. Immunologically, I think the breast milk also contains a lot of bioactive compounds, including antibodies, lactoferrin, which binds to iron and makes it very difficult for some bacteria to survive, and enzymes. So there are a lot of all these bioactive components to it that help boost the baby's immune system as well. So certainly, definitely it should be the first line of feeding.
In your opinion, right, like under what circumstances would it be appropriate to advise a mom to stop breastfeeding?
There are very, very few indications or so-called contraindications to breastfeeding. They can be divided into maternal factors and also baby factors. So maternal factors will be things like, for example, the mother is undergoing chemotherapy. So in our unit, we see a lot of high-risk cases. And the very reason why they are referred over to us in the first place is because the mothers need to see the adult specialist. It could be cancer specialist or heart specialist or kidney specialist. And we are like a one-stop center. So you have all the doctors in the same roof, under the same roof. So, so it's not unusual for us to have mothers who are battling cancer, active cancer, and yet they're pregnant and they deliver. And a lot of them are on chemo. So once they're on some of these chemos, a lot of the times the chemo will go into the milk. And chemo, as you know, is very poisonous. It's considered poisonous to the body. So this will be a very valid reason to advise not to do breastfeeding for that case. And so I have several cases already, and if they're preterm and they will benefit from human milk, definitely be candidates for the donor milk.
I see.
And for the term ones, then actually sometimes out of compassion we offer the donor milk, but actually the baby doesn't really need to. Then we can actually give formula as well.
I see. Understand.
For baby indications, very rare. There's something called inborn error of metabolism. That means somewhere in the chemical pathway in the body, which is so complex, and there's so many pathways. Some of the pathways, they are born with abnormal pathways, and something wrong with the enzymes, so they cannot digest some components of human milk.
Okay.
One example is like galactosemia, so they cannot handle the milk sugar. So in those situations, they need special artificial specialized formula. They cannot take normal milk.
Okay, not even regular formula milk, right?
Yeah, correct.
Yeah. I see. So what are your views on the current protocols in Singapore to encourage breastfeeding?
I don't think there is a national protocol.
Oh, okay. So it varies, right?
Yeah, there's no national protocol.
Okay. So what are your views on like do you think it's a good idea to not have a national protocol? Not a good idea? What can be done to improve, if anything? Yeah.
I don't think we need to protocolize everything. Yeah, so perhaps I don't have any data or any survey on the prevalence of breastfeeding across different units and hospitals in Singapore. And also in the private setting, most of the time they are more service-based. They don't do academic stuff, like try to record rates of breastfeeding and publish them in journals and so on.
Yeah.
So it's almost impossible to know the true incidence or prevalence unless somebody does an academic survey and so on. But my sensing is I think the nowadays people are veering more towards breastfeeding compared to, say, maybe decades ago.
Okay. So why do you think that's the case?
I think it is multitude of factors. I think the tertiary hospitals, at least KK, NUH, and SGH, as far as I know, are very, very pro breastfeeding. And a lot of the patients, I think the bulk of patients, maybe half of them, will deliver in the government hospitals. And perhaps by word of mouth and also sharing sessions, either through their own friends or through a lot of mothers. They have a lot of mothers' interest groups, for example, here on Telegram or some other social media. I think they will share. They will share, and perhaps they will share the benefits. So I suspect this is one way, a little bit like peer pressure. The other more systematic way why this incline is going this way is because the only way, most of the time in Singapore, the only way most of the specialists in Singapore are trained within our own system. Yeah, so they go to, whether it's the pediatrician or obstetrician, they usually go through these 3 hospitals. And if the culture is ingrained in them later on, as even if they continue in public practice or they move on to set up their own private practice, probably the culture is already ingrained. And then actually that's what they will share with their patients.
Good point. What do you think of the information on breastfeeding that is currently being given to women here in Singapore? Should it promote and frame breastfeeding differently? Or if so, why?
What do you mean promote differently? Differently from what?
So, okay, I guess the reason why I asked this question is because some moms, when we interview, have shared that they feel a social pressure to breastfeed, and when it does not go as planned, or when they just cannot breastfeed, or they decide not to persist with it, there's this sense of shame, of guilt, of so you did mention a little bit that there's something like a peer pressure that has been felt among the moms. So do you think that breastfeeding has been the way